And you are live, ladies.
We're live.
Finally.
I'm on Facebook. Yay. Hi everybody, I'm Ashley. I'm sure you recognize us from the online review or the free trial or our Facebook page. This is
Linda.
The infamous Linda McDougall. This is our very first Facebook Live, so we're kind of winging it. If you can't hear us, you'll have to press the unmute button in order to be able to hear us. We encourage you to like this and share this with as many friends as possible because we're all about empowering nurses coming together. So please like and share. If you'd like to throw your comments below with your name and where you're from, because we'd like to see who it is we're able to reach. We're just going to wait for a couple minutes just for some people to hop on and join us live. You can throw up some hearts there and some likes just to let us know that you can hear us and everything's going all right. At the end of our brief conversation today, we're going to be talking about 10 tips to rock your NCLEX or your CPNRE exam, also called in the US the PN exam. So we're just going to talk a bit about our experience helping graduates rock this exam and what we've come to learn over the past few years as we've been doing this awesome work. But at the end of this session, we will take some questions and answers, so stick around for that. Also, at the end of the session, we're going to have a coupon code that can be applied to our website, so stick around for that also. What else am I supposed to say? I have a list here from the boss who's telling me all the things I have to make sure I say because we've never done this before.
Like and share. Everybody's got to like and
Everybody's
share.
got to like and share, says John, and he's the boss. So I think that's all we have to say before we get started in terms of housekeeping. So we're just going to start talking about our 10 tips. We're going to dive right in. So keep track of your questions and throw them at us near the end, and we'll make sure we get to all of those.
Tip number 1 is content review. Ashley and I have come to know over the last few years that graduates of nursing programs often rely on test questions as a means of studying, and this is not a good idea. Really, you need to know your content, and knowing your content should lead you to be able to answer any question. So it really is not a good idea just to strictly get questions and feel like you can pass this registration exam simply by answering hundreds of questions.
I like to throw in there a little bit about the fact that we're not saying not practicing your knowledge isn't a great idea, because it's important that you take core content review and you test your knowledge of it in terms of can you apply that core content to questions. But the mistake many graduates make is that they think they're going to run 5,000 questions and that equates to studying, whereas realistically it doesn't count towards your study process, unfortunately, because guess what, guys? Newsflash. Those 10,000 questions aren't going to be on your NCLEX exam or your CPNRE exam because nobody knows those questions. So it's important that you're taking away rationales from the stem of a question as to why that is the right answer. We're going to talk a bit more about that. But our number one tip is don't mistake running questions as content review. This is why we have this awesome book full of all of the core content that you need to study, as well as the cue card package. And I'm not quite at the throw out the product portion of this, but there's a reason why we spend all of this time going over content. It's super important. Tip number 2, and I happen to be super passionate about this because it's what helped me rock nursing school, which I definitely did, folks, and it is mind mapping. And I don't want you to be afraid of that because there are a number of students who never studied with mind maps, and that's okay. But what's brilliant about mind mapping is that every single person on the planet has a photographic memory and none of them tune into that. When you study through a mind map, for example, this is just an example of one of the pages in our urinary system, peritoneal dialysis. And for example, it has what is it, who needs it, what are the risks associated with it, the nursing interventions, what are the different types, and what is the procedure involved. And when you study in this way with one concept per page, it solidifies the concepts, it compartmentalizes the concepts, and you would not believe how when you're sitting in that chair, you can actually visualize and come to your mind actually the location on the page where this content was at. It's color-coded. It's super, super, super effective. And I had teachers in my undergraduate degree ask me, like, how did you get 99% in pharmacology? And I got 99% in pharmacology, guys, by using mind maps. Because if you just read words out of a textbook, chapters and chapters of words, your brain can't process that into different sections. So mind mapping, brilliant, brilliant, brilliant. The most successful students are the ones that apply that technique, whatever the right word is. Nobody cares about that. So tip number 2 would be mind mapping. The great thing about this textbook is everything's already mind mapped. So shout out to the textbook.
So, and it's not just that we think that that's a good idea, although
Right.
we do think it's a good idea.
A really good idea.
There has been a lot of study done and a lot of research done about mind mapping as a very effective learning technique. The third tip we have also to rock your registration exam is using side-by-sides. Again, studying concepts beside each other, similar concepts, helps you to understand both of them in a more deep way. So they get more deeply embedded in your long-term memory. So if you're studying, for example, placenta previa on its own, then you're just learning that one concept by itself.
Right.
But if you're studying that beside placenta abrupto, then you're being able to differentiate both of them at the same time by looking at them together. And so we have employed that technique throughout this book. Here's an example of side-by-sides in terms of transfusion reactions, for instance. Infection precautions. So throughout this book, and particularly in one chapter where we've got lots of them side by side, wherever we can, there has been side by side charts made up.
Side by side.
Is that what I said? Side by side charts, so that it deepens your long-term memory and your retention of the content.
And what I like to tell new graduates and even nursing students that we teach is this. You will never have a teacher put into a test question what makes concepts similar. It's very, very infrequent that the rationale behind the right answer of a test question is going to be what makes 3 things similar. If you think back to nursing school, you're always tested on what makes things different. And this is what side-by-sides illuminate for you. You have automatic deep critical knowledge because that is the go-to test questions for both the NCLEX and the CPNRE, and here's why. Think back to diuretics as an example. Every single graduate was probably tested on the fact that aldactone, also known as spironolactone, which sounds like a pterodactyl, by the way. That's how I have it in my mind. But everybody was tested on the fact that aldactone is the potassium-sparing diuretic. And just as a demonstration of, that's what makes that concept different. So this is what side-by-sides bring out for you. They give you the differentiating concepts, which is very, very commonly how your registration exam is going to test your critical knowledge. Do you really know what the difference is between 2 similar things? So super duper awesome.
And so a further example would be placenta abrupto and placenta previa.
Exactly.
They get tested together.
All the time.
Because the test question is trying to trick you to see if they can mess you up about which one is which. This is why you must study similar concepts together.
That's right. No tricky. You're not going to be tricked. If you're just hopping on, welcome. We're winging this. It's our first Facebook Live. I just said live. It's really early to start making up words, but that's okay. I do it all the time. Anyone that's been in the live review knows that or watched online. Please like and share this with your friends. We want to reach as many nursing graduates as possible and help as many people as possible. We really want to get to know you guys. So if you can just throw up some hearts, let us know where you're from, like and share. We're going to take questions at the end. So we're going to move on with tip number 4. And this kind of connects to tip number 1 when we were talking about focusing on content and not questions. Tip number 4 is this. If you are doing practice questions, you have to be taking from each practice question the rationale between the right answer that you could apply to any question. Otherwise, you're basically wasting your time, unfortunately, and I know the hours it takes to do practice questions. So what we've done, as opposed to being a test bank, just to show you here in the textbook, at the end of each of the content chapters in the textbook, there's sections that say rock the NCLEX or CPNRE endocrine system, for example. It follows all of the body systems. These are one-liner rationales as to why one thing is the right answer, never changing concepts all the time. For example, in the important one-pager section, when are you actually going to call the doctor before you do some type of nursing intervention? Are you going to sit the patient up before you put oxygen on them? And why? These one-line rationales, which is actually what you should be taking away from practice questions. The good news is we've already compiled all of those for every body system. They're included in the book. But if you're doing practice questions on your own, that's fantastic. Make sure, however, you're taking something away from that practice question, writing it down, and translating that into any question, because of course that's what you're going to face on your registration exam, is any question. Tip number 5, the other thing I want to talk super quick about, is drawing a picture. We have drawing boxes in the textbook, and we thought, like, are people going to think this is silly? Should we really do this? And it's been absolutely brilliant. Not only does it add a lot of humor and interactiveness, it's also super, super effective. We've heard from students that have gotten back to us after they've succeeded and said, I cannot believe how helpful the picture was. I was sitting there in my exam and I got a question on, say, example COPD. I remembered immediately that we drew a pufferfish with big lips. And why is that? Because COPD patients chronically retain oxygen. They can't expel it. So they have hyperinflated chests like a pufferfish, a barrel chest. And pursed lip breathing is the #1 intervention for a COPD patient. So in drawing a pufferfish with big lips, it's hilarious and it's fun, but it's instant memorization. If I were to ask you to draw a picture right now of what nursing means to you, maybe you're gonna draw a heart, I couldn't draw a stethoscope, but maybe you can. You're gonna draw some little picture in 30 seconds of what nursing means to you. Or if I were to ask you to write a paragraph about what nursing means to you, in 60 days, you would remember the picture you drew about what nursing means to you, but you wouldn't be able to recall the paragraph you wrote. So just to demonstrate, a 20-second drawing can instantaneously embed information into your mind. It's absolutely brilliant. So we encourage you to draw a picture because it will last longer. That's tip number 5. We're now going to go on to tip number 6. This is Linda's forte, so I'll let her take it away.
Really, it's important to not isolate yourself. A lot of graduates get their textbooks around them and get into their bedroom all by themselves and spend hours as the days go by feeling more overwhelmed, more isolated, more afraid. It's really key to join with others that are going through this experience. When you join with others, it also helps you to get verbal.
Get verbal. Nobody can hear you.
Get verbal.
Be louder.
Okay, you need to be louder. Linda's very soft-spoken, as you can tell. Get louder, Lynn.
So it's really key to get out of your bedroom and join with other graduates. It also works in that when you get verbal and with others, right, it's another way of learning. So it becomes auditory. You end up teaching each other. The gold standard of learning is teaching. So you're striving towards the same goal. You help one another. It motivates you to join together, to get out of your home, out of where you're living and go to a library. This is all, it all contributes to learning the content more deeply when you can share it with others. So get out of your bedroom.
Get out of your bedroom and join together, okay? One nurse, we are one nurse. Get together, you're not alone. There's hundreds of thousands of people out there. You can hook up with people through our Facebook page. We have a huge network of graduates. We can hook you guys up. I'm gonna talk a little bit about tip number 7, and it's called Get Selfish. Selfishness, we recently wrote about on our blog, but selfishness is commonly interpreted as a negative, what would you call it? Adjective? It's not adjective. What is it? A negative?
Attribute?
Attribute. That's a good word. But a little bit of selfishness is sometimes required for self-preservation. And when you're studying to write your NCLEX or your CPNRE, being a little bit selfish is necessary. And what do I mean by that? I mean, if you're going to devote 4 weeks of studying, which you need to, you're going to have to be selfish with your time. And we recognize that you have a job, and maybe you have a spouse, maybe you have a significant person in your life, maybe you have children, maybe you have parents, family, cousins, friends, right? But you're going to have to politely decline invitations to, it seems like everybody gets married in the summertime, right? Right when all of you students or graduates are trying to study for this thing. You might have to decline some invitations and get selfish with your time. Let your kids knock on your door and say, you know, I love you. I love you. I really need to study. I absolutely adore you. Perhaps you're going to have to spend some time on Netflix, right? While I hammer out the books. This is temporary. It's a temporary sacrifice of your time, and you're going to have to be selfish with it. And it's not going to feel good. But we all know that you're doing this for more people than just yourself. You're doing this on behalf of so many people. So get selfish with your study time. You need that study time. Take time off work. Take a leave of absence. Delegate to anybody you possibly can. Reach out to your support system and ask for help, okay? Those that love you will be there when your study process completes, and they're going to celebrate your success with you. As will we. Will we?
Yes.
As will us? We. We's the right word. So get a little selfish. You gotta. Tip number 8.
Tip number 8. Would you agree with us that you can't possibly study everything? You can't possibly know everything.
Amen.
The purpose of studying is not to know everything, because that's impossible. The purpose of studying is to increase your confidence. That is why we study. Think back in nursing school, the studying that you did. This is not a midterm. So you can't study for this like you studied for a midterm. When you go through the study process, you are attempting to increase your confidence so that you can be ready to walk into that exam center, sit down, and write this test. Which leads us
I'm going to take 9.
into tip 9.
Linda was going to talk about tip 9, but I'm going to take over tip 9. Tip 9, and Linda's usually the emotional readiness guru, but I want to talk a little bit about my experience and how important emotional readiness is. And we know you don't even know that you need to be emotionally ready. You want the content, you want to know exactly what it is you need to know. We get that. But trust us when we say emotional readiness is just as, if not more important in your study process, as is the content. And we know this because some of the most brilliant graduates with the highest grades haven't been successful on their exam. And it's not because they didn't know the content. It's not because all of these other things. It's because they were not emotionally ready to walk in that room and sit down at that computer. My emotional readiness came from a bunch of things. I knew the content wasn't going to get me because I'm pretty brilliant with content. I knew it was going to be my own confidence level, right? My emotional state, that if I came across a question I didn't know the answer to, I was going to freak out. And that's because I'm a perfectionist. So when you told me I needed to know 20 chapters to write an exam, I would know 20 chapters, no problem. I never trusted myself. So on the day that I wrote the NCLEX, first of all, I had Linda send me a super awesome, empowering message, which we love to do for graduates. I called my brother, who's my best friend. He's probably on here. Shout out, throw out some hearts. Derek Bully, if you're on watching me live, you better be. Say, hey, little sis, what's up? So I said to my brother, I need to listen to an awesome song before I walk into the test center. And he was like, Eye of the Tiger. And I was like, it's too obvious. Like, no. So then he said, Bootylicious. And I was like, no, not really the vibe I'm going for. Walking into the NCLEX, I ended up listening to Sail by AWOL Nation. Totally pumped me up. Like, I walked in there like I was going to slay a giant. And that's exactly what I did. And fake it till you make it, guys. If you're not actually emotionally ready, pretend you are. Get in that mind frame, right? You have to walk in there confident and ready and fool yourself into thinking you are, even if you can't muster it up, okay? It's a psychological game. Preach!
It really is.
Emotional readiness is so, so, so important. So that's tip number 9. You may not know you need it. We know you need it. We've collected data on it. We're publishing about it. It is so, so, so key. So please trust us in that you need that. The last tip.
Test day.
Test day.
During the exam.
That says during, D-U-R-I-N-G.
So during the exam, a lot, if you're writing the NCLEX, a lot of graduates hope that it's going to turn off at question 75 and that they've been successful. And sometimes when it doesn't turn off at question 75, they fall apart. You can pass this exam in 75. You can pass this exam in 265 questions.
Yeah, you can.
And for the PNs who are writing the CPNRE, you're going to write the whole test, right?
Mm-hmm.
So the point is that it's very key that during the exam you do not fall apart.
You have a game plan, people.
That you use your breaks, that you bring food with you, that you take the breaks, you go to the bathroom, you get regrounded, that you do not lose it, because during the exam, while you're writing, you have to stay focused until it's over.
We talk about it in the context of, I'm not going to give it away because that's a special thing for the people who take our review, but we call it not abandoning your ship, sailors. You're steering the ship. Steer it towards success. You don't bail out on the ship at question 75, okay? There's going to be questions you don't know the answer to, and that is okay. That's okay. It doesn't mean you're not going to be successful. You cannot bail out on yourself. You cannot abandon your ship, okay? Sail it into the sunset of success, ladies and gentlemen. Okay, so that ends our 10 tips, but don't go away yet because we're going to take questions and answers. And we're just winging this, so we're going to have our lovely assistant Mel just shout them out to us. Throw up your questions if you have any.
There's none yet.
No questions yet. Anybody got any questions?
We have some viewers from California.
Woo,
Calgary,
Callie!
some Chatham, Windsor.
Hey, Chatham. Hey, Windsor. California. Oh, how's the weather in California?
Robin popped in. Didn't she just pass? Robin from Windsor passed.
Nice.
She just popped in.
Woo, nice. Fantastic. So let's talk a little bit about the products. Interrupt me if we have a question.
What happens if you fail?
What happens if you fail? If we're talking about the NCLEX, what happens if we like to redefine that F word?
We have a blog on that.
We have a blog on redefining that F word. Failure is a lot of things, like lack of facts, fear, right? Fairness. So failure is associated with some negative stuff. What happens if that happens? You recover from it. You regroup and you do something different, right? You do something different. If it's the NCLEX, you have unlimited attempts. You have to wait 45 days before you can rewrite. You can rewrite unlimited times. The CPNRE exam, you have 3 attempts at the registration exam, after which you will have a nursing diploma without the ability to practice. So there are many students who aren't successful on their first attempt. We help many students after they've already attempted because they just feel like they need a coach. We met with someone the other day who was looking for a coach. So it's okay if you don't. Right? There's people all over the place that don't. You just regroup, you do something different the next time.
And it's really key that you don't let it stop you.
Absolutely.
You know, we meet a lot of people studying for this exam, and we come into contact with all different kinds of stories. It really is so important that you don't let it end with your first attempt.
And you heal from it.
Yes.
Because this exam does not define your value in the nursing profession, okay? You define your value in the nursing profession. We have a 99% pass rate after people come to our program. And unlike most programs, that includes those who had been previously unsuccessful, even some up to 6 times. And we still have a 99% pass rate after our program. That combines the content with the emotional readiness. Any other questions, Mel?
Not yet.
Okay.
Krista says you are wonderful. So great to see you both reaching out and helping people in your beautiful way.
Aw, you're
Thank
beautiful
you.
too. Thank you so much.
Thank you.
So our textbook, just to tell you a little bit about the contents of our program, it's a full content review. You could try a free trial of our program online for 7 days. It's a 7-day free trial that gives you access to the teaching videos and the cardiac chapter downloadable through a PDF. If you'd like to experience the teaching is very different. It's drawing, interactive, no PowerPoint lectures. I'm not a fan of those. So our textbook includes all of the body systems, all of those one-liner rationales, all of the core content you would need to know, as well as this cue card package. That's all of the memorization components for the exam. So all of this ships to your door, or if it's a live review, we bring it to the first day of the live review. So we have live and online options. I know online scares a lot of students. I was included in that, or graduates I should say. But it's not like we're not in puff sleeves, right, sitting in front of floral wallpaper. Not to say that that's what most people do, but it's interactive, we're drawing, it's passionate, it's fun, you will not be bored. The feedback we have on the online option is fantastic. So the online option, we ship everything to you, you have 90 days access, you can watch the teaching of the entire book as many times as you need to, which is awesome because if you have weak components such as labor and delivery, maternal nursing, you can watch that over and over and over again. And why would you not want to hang out with us over and over and over again right in your living room, right? Just bring popcorn, right? Bring snacks. We like to have snacks. So we have online and live options, and the live review is 4 days. We teach this entire course in 4 days, the whole book, and then you get 30 days online access to review the concepts over and over and over again as you study and you prep, and you build up your confidence to rock this exam. You're going to rock it. We would love for you to hop onto our website. You can use, let me read this, I can't read my own writing, www.n-powermentnursing.com/Facebook, and use the coupon code July50, and that will give you a discount off the cost of our program. You can also visit our website, www.n-powermentnursing.com, and subscribe to our blog posts. We've done so much writing about redefining failure, overcoming roadblocks,
Defiance.
Tips for success, defiance, tons of stuff. It goes on and on and on. So we encourage you to hook up with our blogs. Very passionate, very awesome. We throw out 3 of those every week. Join our Facebook page, and N-Powerment, I believe it's N-Powerment NCLEX/CPNRE prep, something like that. And we put out test questions every week that you can interactively participate in. And I think it's the next day the rationale to the right answers put out there. Any more questions, Mel?
Nope.
So please like and share this video. We thank you so much for spending some time with us on this beautiful Wednesday evening. And if you have any questions, shoot us a message. We respond to them. We actually got a badge from Facebook because we respond to messages within 2 minutes, people. 2 minutes. We earned a badge from Facebook. It's a real thing. We got a badge. It's pretty awesome. So send us a message. Ask us a question. We are more than happy to answer any of your questions. Don't be shy. There is no foolish question. So we're super excited that you joined us, and we'll probably get better at this process because it's our first kick at the can. But we'll catch you later. Do you want to say something? I'm just
I just want to maybe say one of these great quotes that I really love.
Oh yeah, ending with a quote. That's good when you're writing papers too.
I never fail, I either win or learn. And that was spoken by Nelson Mandela. After so many years in prison, he could still say that. And it's finding another truth, right? Finding another truth in your experience. And that's what it means, right? That's what it means to be successful, to stay in the game, to not let this high-stakes exam scare you so much that you stop trying. Whether you choose to join us or not, we want you to join the nursing profession. So keep trying.
Keep trying, and we invite you to join us and get empowered. See you later.
Thank you.
Cut. We done? I don't know how to shut it off. Cut.
Cut.